Well, new this morning, Action News Jacks, we are starting a brand new segment here where we talk and discuss all things health. And to kick it off, we are joined by local oncologist Dr. Scott Ackerman from the Ackerman Cancer Center. Thank you so much for waking up with us early and joining us this morning.
Thank you for having me.
We appreciate it. So September is Sickle Cell Awareness Month, and it is something that many people, they aren't as familiar with. I am. My husband has sickle cell, but really break this down for our viewers on what sickle cell is and how it impacts people's lives.
So sickle cell disease or sickle cell anemia is a genetic blood disorder, and it's marked by the fact that the red blood cells, the hemoglobin, instead of being nice and round and smooth, they're kind of shaped like a sickle.
Yes.
And because they're shaped like a sickle, they don't flow so well through the blood vessels. And that action of not flowing well through the blood vessels sometimes get them stuck in some small little blood vessels, and that causes all sorts of symptoms.
Yes, and one of those symptoms is a pain crisis. That is what many people aren't as familiar with. And also the fact that this is genetic. The first thing people often ask is, well, when were you diagnosed, or when did you know you had sickle cell? So kind of break that down for people.
Sure, so this is a genetic disorder, and so it's more prevalent in African Americans, but other cultures can have it as well, or other races can have it as well. We see it in North Africans, there's some in Mediterraneans, but mainly in African Americans. And there's about 100,000 people affected every year.
Wow.
And 1 in 13 African Americans have the trait, but only 1 in 100 and 1 in 365 actually have the disease.
Exactly.
So I remember that number because it's 365 days in a year.
Yes,
So,
oh, that's a good way to remember, yes.
And so, because you have to have both parents have the trait, and then you could possibly inherit it. So many African Americans, when they're born, black babies are typically tested because they're at higher risk. So anyone that's at higher risk, and if a mother or father has the trait, those children are tested immediately upon birth.
And talk to us here, especially in Jacksonville, what are some of the treatment options? Because there's so many different options here. I know my husband, he gets a blood transfusion, so he goes once a month. What are some different options for people who do have sickle cell here?
You know, sadly, there's no real cure for it yet. And so we treat patients when they have symptoms. We treat them symptomatically. Sometimes, you know, kids will come to the emergency room. We treat them with pain medications, with fluids. If the sickle cells are as many, as you said, blood transfusions are used. With more advanced cases, patients are treated with a stem cell transplant. Now that's that's very difficult. It's not just that it's expensive, but it's just very, very difficult on the patient because it frequently involves chemotherapy or radiation therapy to prep the patient for that. And the stem cell transplant, you have to get the stem cells from a donor. The donor is usually a sibling. It's hard to necessarily have that match. You can have mismatched things, and you can have rejection of that. But what's pretty cool, and that's happening, that's the current research, is with genetic gene therapy and modifying the patient's genes and kind of reprogramming their genes to correct the abnormality that causes the sickle cell.
That is very new, also new technology there. And a question for people who are watching, what can we do in the community to really educate ourselves? I, have the luxury of my husband is diagnosed, so I have a better understanding, but people in the community, what can we do to really learn more?
Well, if you are at high risk, or if you have sickle cell anemia, someone in your family, or if you're at high risk, it's important to understand it and know more about it so you can be responsible and you can help educate your neighbors. The more awareness, the better treatment, the better people can intervene quickly and minimize the adverse effect of sickle cell disease on people. And so there's national organizations for sickle cell anemia. There's lots of community organizations that have bound together. Some of the faith-based community organizations will provide sickle cell education as well. There's many of them in the community. So just reach out and Google it and you'll find many of them.
A lot of different options. Thank you so much for your time. Thank you for waking up with us this morning. And thank you also for tuning into our first Health Alert segment. We're going to toss it back to you, Chandler, over in the Weather Center.